Good afternoon. Can you see the image on in front of you?
We can, Alan, yeah.
Okay, so Martin, first of all, I'd like to thank you for the invite today. I have my two colleagues here who both give short presentations on two such innovations within the Mater Hospital. Before I do so, I just kind of give a very quick overview of what's happening in the hospital in the digital space. So we kind of break all of our digital platform, our digital developments into several sections. We have research, we have education, we have corporate, and we have patient quality. Now, in the research end, there's a couple of really nice research programs that are looking at artificial intelligence that will support decision making by clinicians. So one of them is in surgery, and the other program is operating in radiology. Both have large commercial entities engaged with the institution, and both look to help reduce error and provide better patient outcomes as we move forward. Very exciting programs in the early stage, and there's many more programs in our research pipeline that will deal and be built upon digital platforms. Education, given the environment that we're in, I think everybody has realized that digital tools provide the optimum solution to get our teams trained in the areas they need to train. So we're more reliant on this type of medium where we can communicate on Teams or Zoom or wherever the platform may be. And we're also more reliant on e-learning. So there's an awful lot of development going on in the institution in that space. When we move to the corporate side, we have, and I have some slides, but to be quite honest, they're not, they don't give it any justice. So we're looking at the surgical technology. We spoke about that. Apologies, I should have kept going. So robot and process automation, and this came to us from the HSE, from your own team, and it's one of those spaces that we see huge opportunity within the institution. At the moment, because of COVID and the increase in compliance and documentation required in business, it's becoming extremely difficult to manage that capacity. So we're starting to use bots, and we used one really successfully to help manage activities for our IPC team during COVID. That freed the team up to do activities on the ground, patient-facing, supporting the staff and keeping the hospital safe. So this was able to save something in the region of 3 hours per day from a number of individuals who would have sat in front of PCs entering in data to try and track the work that had been done. We see these bots being spread across the institution to support our finance department, HR, coding of clinical notes, and so on and so forth. So in the corporate side, we see digital tools and digital platforms forming the backbone of cost containment and WTE containment within the business, as we can grow at the front line and put resource into that position. And we move into patient safety and quality. And at the moment, we've been very lucky to receive some funding from the HSE in respect to digital platforms for the likes of e-prescribing, e-observations, discharge summaries, medical notes, and so on. And we're starting to look at building those tools. We know that there are errors in the application and the delivery of medicines and various other services that digital tools will help to eliminate. They'll allow the hospital to become safer. They'll provide huge efficiencies for the teams that can make decisions in remote locations versus having to be up beside the patient. It'll allow documentation to be accurately record decisions that are made remotely when the clinical teams are not at the side of the patient. And it'll also allow early intervention into the welfare of a patient when the systems actually see that the patient's well-being is drifting in a direction that requires some form of intervention. So we see this as a real game changer for us, and we're delighted with the HSE support of it. And the living labs within the institution will provide a great backdrop for us and a great support to help us develop into the future. We, during COVID, have actually switched about 30% of our outpatient appointments over to digital platforms, and that's provided us with something in the region of about 75,000 appointments that no longer come on site. Most of those appointments would bring a friend or a partner with them, and that's 150,000 people that don't need to come to site. So as part of our infection control, it's fantastic. The feedback from our patients, from our telehealth, you can see them up there. It's about travel, it's about convenience. So all of these are now conversations we would have had in the past about many other services, not necessarily health. And those convenience and access and time-saving devices are now actually being recognised in health as absolutely essential for us to drive efficiency, but also for the patient experience. And that's an area that we are looking to focus on. So, you know, overall, we've got a very firm position within the institution, is that we are going to grow our digital footprint. We are trying to grow it probably a little bit faster than we would do. Our learnings from this is that, you know, we are starting on a very embryonic stage in some sense, given the fact that the institutions such as our own, we have teams that have in the past helped build systems, but not at the scale they need to be built at. They would support legacy systems that haven't the investment that maybe we need. And, you know, I think champions like Martin and his team to drive the technologies to get the message across that it is digital platforms, and it's through the innovation that the likes of the health, the digital hubs will actually create, the learning hubs will create, that we will actually get traction in the business cases for further investment to help move these forward. So without labouring the fact that we're moving in this direction, I think more is to see a couple of examples. And today we will have the MyPatientSpace, and Tracey Fitzpatrick will jump in and will run through that. And there's a couple of notes on Tracey's project there for anyone who wants to read it. And then we've Caoimhe Fitzsimons who got introduced on the Voicera. And, you know, again, the technologies that both ladies are providing have been shown to be hugely successful in the institution, and the need for them is growing. So I'm going to switch slide sets over now, if it's okay, and I'll let the two ladies actually present their slides. I just need to figure out how to stop sharing.
Thanks, Alan. That was great.
Martin, just.
Back to the meeting.
Are we out of the meeting?
No.
Sorry, Martin.
And just on video, just keep it muted there. Great, and then we close that one and go into PowerPoint. And this is great. You can just pull that over and then start.
Great, we see you there in the matter. So
okay, I'm just going to hand over to Caoimhe. Will you sit there and do the changes for us?
Can you see Caoimhe okay, yes?
So yeah, Caoimhe, we can see Caoimhe.
So Caoimhe, if we can get you just to press share, or would you like me to drive the slides?
Oh yeah, no, we can share.
Brilliant.
Sorry.
That's okay.
Share now. No, did you not share it on there? Okay, I click share first, yeah. And then you this one. Oh yeah, you're there actually, yeah, screen one. Yep.
There we go. Great.
Great. And you can pull that over if you want to make it easy to do. Great.
Is that okay? Everyone can see that? Yeah. Hi everyone, thank you Alan for the introduction, and thank Martin and team for the opportunity. I'd like to talk to you about our Voicera communication project. So it's, for the matter, it's been a revolutionary new communication technology, and it facilitates direct communication between clinical roles and our support staff. For example, we've implemented it across disciplines with nurses, doctors, porters, admin staff, the FIT team, and some of our management team as well. And it has allowed us to simplify and speed up processes, as well as introduce the technology. You can see here on the left, it's called the Voicera badge, and this is one of our porters wearing it in the photo. It's a hands-free communication device that allows, it's Wi-Fi enabled, so it works across the campus, and it works by voice activation, so you can wear it under PPE. It also it allows us to call each other by user or by role, so you don't need to know who's in a particular role to contact them directly, and you can forward any unanswered or offline calls to a mobile. It works, it defaults to speaker mode, but it has the option to do not disturb, and you can use it like a phone as well for more private conversations or to discuss patient information. So what we were hoping that it would bring to the matter was improved communications between the COVID zones across the hospital, which it has done. And prior to this, we were using walkie-talkies, which were unreliable, especially in the ED. And the ability to wear it under PPE has been great, so that our staff don't need to leave the patient to use other communication devices. That two-way instant direct communication has been a huge benefit, and it's replaced the need, particularly in the ED, for tannoy communication, so it's helping overall noise disruption. The integration with the telephony and pager system has been huge. So because it's reduced the number of communication transactions required to complete a task. So in the past, as you can imagine, you would have to leave the patient, find a phone, find a bleep number, and then bleep somebody and wait for a response, whereas now we can connect with each other instantly. And then on top of what we were hoping it would bring, it's also shown some more realised benefits. So we don't need to enter contaminated areas, which allows for conservation of PPE, which has been key as well. We don't need to share desk phones, so you can use your badge like a phone, which obviously reduces contamination in COVID-19. And as I said, it's dramatically reduced the time it takes to connect with each other. It's allowed for device replacement, so the porters in ED have now replaced the radios they were carrying, and device consolidation, so it has things like a panic function on it, and so reduces the need for us to buy personal alarms. We can communicate anywhere on the hospital campus, so examples of this are the site nurse manager or the ICU reg who would be out and about around the hospital. And in the past, they were having to find a desk phone to answer a bleep, and now they can answer a bleep using their badge. It's also enabled staff to stay with deteriorating patients while they connect to other key clinical roles. So like the airway, any of the resus staff looking after an intubated patient, they can stay at the airway and call the ICU registrar, for example. And it's shown efficiencies and process improvement, which aligns with the Matters lean thinking methodology. There's an inbuilt address book, so this is allowed for reducing cognitive overload and the need for staff to look up phone numbers or remember phone numbers. So an example of this is I can say call blood transfusion lab and it will connect me directly to the phone. And set task reminders. So there's an example of this is our ED nurse in charge was having to remember 5 times a day to batch send COVID swabs to microbiology, whereas now the badge goes off at the designated times to remind them. And then outside of COVID, then we can use it for things like broadcast function. So for time-critical patient presentations, for example, we've implemented it for our silver trauma calls and the hip fracture pathway, and we're almost ready to go live with fast calls. It also, another big attraction is that not everybody needs a badge. So for an example, this is our nurses in the ICU cubicles can connect to the nurse in charge or the registrar, for example, using the phone in the cubicle. So they don't need to remove their PPE or leave the cubicle. It can go from badge to phone or vice versa. And it comes with a comprehensive analytics platform, so this allows us to measure data and create and meet KPIs. And we can share these reports with each department. We have been the first site in the south of Ireland to introduce this digital innovation. So it clearly aligns with our own strategic goals, and it's a great example of digital innovation in the pandemic. The company themselves, for the first time, did 100% remote deployment. We were their first customer to do this, given the pandemic. So we were on calls with the US and the UK, because normally they would have been on site for the whole deployment. And I have to say the staff engagement has been enormous, and that's the main reason for the success of the project. So it was very quick. There was 6 weeks in June to August for the clinical and technical deployment and testing, design, building, and training our staff. And the internal team was made up of clinical staff, our colleagues in IMS and telecommunications. We're now 3.5 months into post-deployment, and as you can see there on the right, we've made almost 50,000 successful calls between badges and from phones to badges. And we've 447 end users fully trained and using the system. So we've 40 badges, and the 8 departments that we've implemented it in are the emergency department, ED, radiology, critical care, acute medicine, our patient flow department, admin staff, and the site nurse managers and senior nursing leads. And you can see here another example from the analytics. So the blue zone nurse is a brand new role, which is the nurse lead in the non-COVID ED, and they have received the most calls. And then, not surprisingly, this is followed by the ED porters and then our registration staff at the front desk. This is an example of, as well as implementing the technology, we've used it for process improvement, and our fast stroke pathway is already a great example of lean methodology, and our door to needle times are very impressive. But the ED nurse in charge that receives that pre-alert call calls the stroke team, but as well as that, still have to contact a number of different people within the department, as you can see in the as-is pathway above. Whereas with Voicera implementation, we'll be able to do that in one step and contact everyone directly. And I would like to do a demo of that for you now. Broadcast fast call.
Broadcasting to fast call.
Hi everyone, this is the ED nurse in charge, 63-year-old female, fast positive in Resus 1, ETA 4 minutes.
Hello, Digital Academy Forum. It's the stroke nurse here.
Thank you. The integration capabilities with it are that it can integrate with our EHR, and we can use it for integrating with electronic obs. So, for example, a nurse looking after a certain set of cubicles can be informed of a deteriorating patient early. We can integrate with the digital patient call bell system in the future and receive critical alerts. The Voicera app is the Vina, so that will allow us to use the system off campus. And an example of this would be that our stroke consultants want to be notified at the same time as the rest of the team of a fast call. At the minute, the badges work on hospital Wi-Fi, whereas this will allow them to receive that notification off site. And we hope to have further device deployment as well as improve more clinical workflows and contribute to the Matters Working Differently initiatives and other work streams, for example, deteriorating patients. Thank you for your time, and these are our contact details.
Somebody just said in Nassau.
Great stuff, team. Thanks for that. Really enjoyed that, and thank you for the live demo as well.
No problem.
Have we another session slides to come?
Yeah.
Excellent.
Why is that not being shared? Not letting us share.
Okay, bear with me and I'll just check here.
Yeah. You
Okay.
have, maybe.
Just
Oh,
check there and see.
Yeah, no, it's here. Yeah, great.
Great.
Um,
We can see those now. That's great. So if you want to press Control and L on your keyboard to go full screen. Control and L.
It's PDF, so it might be that.
Yes, that's for PDF.
Click on the actual document. Okay.
Not to worry, we can go with that. It's great. So you're on mute on that end. I'm just going to unmute you manually.
Okay, thank you.
Okay, you're back now.
Hi, Martin. Thanks, Caoimhe. I'm here. My name is Tracey Fitzpatrick. I'm Director of Nurse Manager of the Cancer Directorate. And as I always caveat my conversations with Martin and Des and HSE, IT is not my background. My background is cancer and cancer nursing and the cancer nursing service in the matter. So any digital solution that makes our patients feel more connected and transform their journey is a real game changer for us. So MyPatientSpace digital health interventions open the possibility for cancer patients, survivors and their families to manage the disease and the side effects when they return home after treatment. MyPatientSpace is key in transforming the patient cancer journey. The platform offers rich, personalised medical-grade digital health companions for staff and patients. MyPatientSpace will allow cancer patients and their families to stay connected and improve outcomes through better engagement. And I suppose this is the science bit, really. The solution that they offer is end-to-end platform for communication, collaboration, triage and virtual care. And all of those are really important in the delivery of cancer treatment, configurable for any cancer journey. And in my role in the matter, I look after all the cancer sites. So it's really important that when we have set out the cancer journey, we can lay on each site on top of that so everybody has their own unique pathway. Smart engagement, powering rich digital engagement and automation at the right stage in the cancer journey is really important. We don't want to give patients too much information, but we want to stage the information to the patients, ensuring that they have all the information they require. Surveys, prompts, feedback and toxicity management and remote monitoring are really important in the management of patient toxicities and improving outcomes. The future really is to scale our cancer services with digitising our connections with our patients, driving efficiency in care, improving timely education, tracking symptoms, automating reminders, enabling self-management and patient participation in care, and connecting with healthcare teams. We look at the hub and spoke model that the NCCP are describing for cancer care as we move into the future. This is going to be really important, and an element of self-service. So we looked at the literature, obviously, and before we went on this journey, and the digital health interventions, new and emerging tool to enhance patient engagement. The literature review revealed that digital intervention and digital tools can have positive psychological effects and benefits for patients. It is a lack of standardisation of metrics of which measure the outcome of the studies that makes results hard to compare. So we're really on this journey. We plan to define the standard metrics that we will include, and those are going to include patient questionnaires, quality of life scores and holistic needs assessments. So the perceived benefits are improved patient and family engagement with education material which is personalised and curated, improved interaction and reporting with self-assessment tools and toxicity trackers. We know in cancer treatment, if we can identify toxicity and manage them earlier, we improve patient outcomes, we reduce hospital admissions and we can reduce length of stay. Increased compliance with oral anti-cancer medication using patient reminders and feedbacks would be a real benefit in this cohort of patients. A daily reminder, some of these drugs require complex preparation, taking them on an empty stomach, and feedback from the patients when they've taken the medication to show adherence to protocol is really important. Real-time updates to patients, for example, medication alert. During COVID-19, we closed down our oncology hematology day service on a Friday. We moved it off campus. We literally pushed our service to the Centre for Nurse Education just across the road and set up our service outside the hospital because of our vulnerable patient cohort. We did business on a Friday and we were ready to go on that site on a Monday. But over that weekend, we had to make 120 phone calls. We had to deploy maps. We had to have somebody standing at the front door directing patients at the hospital and one at the Centre for Nurse Education. And while our patients really valued not having to come on campus, there was a huge requirement around communication. Being able to update those patients in real time and give them that information and control would really help us. Reminders around vaccinations, cervical check, as different events come in the media, it can cause a lot of anxiety for cancer patients and their family. The cervical check issue is a major problem for families. If we can send a real-time update with a contact number to those patients and their families where they can receive help on a helpline, will really impact them. COVID-19 screening is a large daily admin task since the pandemic began. The MyPatientSpace app allows for patients to be screened, and the patient then reports that back to the admin and no phone calls have to be made. Monitoring specific tasks, for example, drainage from drains, reporting that back to the staff, and that makes decision-making around removing the drains easier. So the implementation, so there's the cancer sites that we hope to implement this across. The initial team we chose was the gynae oncology team. They're a highly motivated team. They've been through 2 years of visual stream analysis and rapid improvement events, so they're a really good team to work with, and they're really motivated with this project. So we have 5 weeks from kick-off to go live, and we hope when on site to lay down the generic pathways, and then when we come to the next cancer site, we just have to overlay the specific cancer information for that site. So week 1, we plot the patient journey, gap analysis of information required. Week 2, we've added the patient information to each step of the patient journey. Week 3, we've had great engagement with Una and her team. They're going to provide us with a test system for staff. And then we're going to have a patient focus. We review the process at that step to ensure that we're on the right track. Week 4, we're going to review all the information, the final app, identify any further gaps. And week 5 will be patient information, training, and go live. I should say that this has been rolled out in 5 hospitals in Dublin. 2 other cancer centres are also using it, and we have agreed a collaboration process. So we're all doing a different site first, which is really opening up relationship outcomes for our patients. So really excited about this project and the matter, and we're hoping that 2021 is going to lead us to really stronger communication and engagement with our patients via this space. There's my contact, and there's Una at MySpace at MyPatientSpace.com. Thanks very much.
Great, Tracey. Thank you so much for really good presentation. So looking forward for the go live in January. Just to mention, actually, I think St. James's have just come up with on renal, have their first patients on the app. Caoimhe, thank you for a great presentation, and we hope through spotlighting what's going on in the matter with Voicera, that this could be a technology that could be widely adopted across the acute sector, and great to see how it's evolved in the matter. And thank you, Alan, for your stewardship and being such a great digital sponsor for these technologies.